Fasting. Fasting refers to voluntarily abstaining from food and, in some cases, beverages for a specific period. While there are various types of fasting, such as intermittent fasting and extended fasting, the potential benefits often associated with fasting include weight loss and improved body composition. Fasting may promote weight loss by helping to reduce calorie intake and induce a metabolic state that favors fat burning. It may also help preserve muscle mass. Improved insulin sensitivity. Fasting has been shown to enhance insulin sensitivity, which can be beneficial for blood sugar control and reducing the risk of type 2 diabetes. Cellular repair and autophagy. During fasting, the body may initiate cellular repair processes and autophagy, which is the body's natural process of recycling and removing damaged or dysfunctional cells. Potential cardiovascular benefits. Some studies suggest that fasting may have positive effects on cardiovascular health by reducing blood pressure, improving blood lipid profiles, and reducing inflammation. However, it's important to note that fasting may not be suitable or recommended for everyone. Individuals with certain health conditions, such as diabetes, eating disorders, or other underlying medical conditions, should exercise caution and seek medical guidance before attempting any fasting protocols. Foods to limit or avoid. While dietary recommendations can vary depending on individual health needs and goals, there are some common dietary guidelines that suggest limiting or avoiding certain foods for overall health and well-being. Some examples include processed and sugary foods. Foods high in added sugars, refined grains, and processed ingredients are often associated with negative health effects. These include sugary beverages, snacks, desserts, and heavily processed foods. Trans fats and unhealthy fats. Trans fats, commonly found in fried foods, baked goods, and processed snacks, are known to increase the risk of heart disease. It is advisable to limit or avoid foods containing trans fats and opt for healthier fat sources, such as avocados, nuts, and olive oil. Highly processed meats. Processed meats like sausages, bacon, and deli meats often contain additives and preservatives and have been linked to an increased risk of certain health conditions. It's recommended to moderate the consumption of processed meats and choose lean sources of protein, such as poultry, fish, legumes, and tofu. Excessive sodium. High sodium intake is associated with an increased risk of high blood pressure and cardiovascular problems. Limiting the consumption of processed and packaged foods, which often contain high levels of sodium, and opting for whole, unprocessed foods can help reduce sodium intake. It's important to note that individual dietary needs can vary, and it's best to consult with a healthcare professional or a registered dietitian to receive personalized advice tailored to your specific health goals and requirements. They can provide guidance on dietary modifications, fasting protocols, and help develop a balanced and sustainable eating plan.